1 in 68 children in the U.S. has autism spectrum disorder. That is according to a report released by the Centers for Disease Control and Prevention. Now, I want you to think about this. That's up 30% from 2 years ago, when the disorder affected 1 in 88 children. And boys, they face an overwhelming higher risk of having autism than girls. Autism affects 1 in 42 boys and 1 in 189 girls. Now, to talk more about this, we're very pleased to be joined by Lisa Goring. She's Executive Vice President of Programs and Services at Autism Speaks in New York City. Lisa, thank you very much for a few minutes. I appreciate it.
Sure, thank you.
You obviously are intimate in this community, and you can put a face on this for us, but were even you surprised at the latest numbers and really the velocity that we've seen in terms of diagnostics from a little over a decade ago to where we are now?
Unfortunately, I can't say that I was really surprised. We've seen increases over the last decade or so, and a 30% increase in 2 years is rather startling, but it really calls for a national plan so that we can help to understand why this is happening, but also, more importantly, to provide supports and services for those that are living with autism.
And I want to talk about both of those, but from an anecdotal standpoint, you've seen this. Is it just that we're doing a better job at diagnosing this population than we have in the past, or are more and more families finding out that their children fit this definition than ever before? Is it that we're just smarter about this, or that this population really is exploding decade by decade, year by year?
So it's a little bit of both. We know that we are diagnosing better, which is the good news, but we also don't understand why. That would account for about 50% of the increase. We don't understand where the other 50% is coming from. We know that autism is caused by a genetic factor, but then there is an environmental trigger, and that's why the research is so important, because we don't know what that is, and through funding more research we hope to find out.
And we're obviously in an important time of the calendar on this, tomorrow being World Autism Awareness Day. But when you talk about research, talk about the need, what need for the research, and also give an idea to the public where that money would be spent if more dollars went towards it.
So we need to better understand the cause of autism. We need to better understand what treatments are effective and what services are needed throughout the lifespan.
You know, all of us either have it in our families or we know friends that are going through this. The one thing that I've heard from so many people is, Rich, you have no idea how hard it is to navigate the system, especially when it comes to schools and school districts. Right. There's no playbook that's easy to follow here. It almost depends on your zip code, the different type of treatment, reimbursement, etc. Give an idea to the general public at home that's not living through this, some of the hurdles that they have to navigate here, and why some places are so much better than some others.
So when a family first gets that diagnosis, if their child is under the age of 3, they would call their local early intervention. Once the child reaches the age of 3, then the school district takes over, and the school district is responsible for services ages 3 through 21. And that's a whole separate system. So on top of a family learning about what autism is and how to best support their child, they also now need to learn an entirely new system in terms of working with their school district. They need to become advocates, and they need to understand special education law. At Autism Speaks, we've really tried to help families with this. We have an autism response team that's trained staff that can answer emails and phone calls from families anywhere in the world, but especially in the United States. We have regional associates who can really help families as they go through the process. Anyone can go on to autismspeaks.org, and we'd be glad to help them navigate in their local school system.
And Lisa, when you say they need to be advocates, sometimes it's even more than that. They literally have to fight
right.
for their kids, retaining attorneys here, from everything from if they can get a school bus to pick up the kid, what kind of the school district, if it'll take care of the child, if it's the right programs for it. I've heard so many frustrating stories where the schools almost say to them, listen, if you sue us, it'll be almost easier, as perverse as that sounds here. It really hasn't gotten enough clarity, at least on the state level, let alone the national level, to have a more, I think, comprehensive safety net for these families, right?
I think you're absolutely right. And that goes back to why the research is so important. We need to have evidence-based strategies that help support kids with autism in their public school system.
Well, we're going to bring up your website once again. As we said, tomorrow is World Autism Awareness Day, but it's not just about getting more funding, which obviously everybody agrees should be there, and more clarity in terms of the services for families, but it's so many people, when they come into this world and they don't know where to turn, they also need to know a lot of people are going through this as well, right? And there's a strength in numbers.
Absolutely. We at Autism Speaks embrace families. We want them to know that they're not alone.
And we are bringing our audience into this conversation as well. We all know the spectrum is very wide here, and no one case is identical to another. Right. But obviously, given the numbers we just heard from the CDC confirming what a lot of people thought, this is a major issue of certainly this generation. Lisa Goring, I appreciate the time. Thank you so much.
Thank you.
All right, autism has touched, it's amazing, in just my lifetime, the spread of it. And for all the reasons she said, it's better diagnosis, but there's also something going on. And I'm not obviously informed enough, nor do I think anyone is, to really pinpoint exactly what that is. But Andrew, I mean, we say this has touched everybody. You have a personal experience with this as well, right?
My nephew is on the spectrum, and it's been difficult for my sister and her family. There have been issues with the school district. There are concerns. He's 16, so there are issues about what happens when he becomes an adult, college capabilities, adult lifestyle. How independent will he be able to be? And you see that, and it's a concern because it comes up at every family gathering. And then there are all the questions because we don't, know what causes this, and we don't know what influences it. And I'm 42, and I'm lucky enough to be headed, hopefully, towards a family of my own at some point. Is that have we passed the magic age? Are we exposing ourselves to an enormous amount of risk if we decide to start a family? Should that be an argument in whether we determine whether we do start a family or not? I mean, those are all unanswered questions, and the downside is so significant, the difficulty is so enormous that it does make legitimate questions about how you're going to live the rest of your life and how those who are affected live the rest of theirs.
I've been exposed to this through friends and stuff, and the one thing I'll just say anecdotally is it shouldn't be as hard as it is for these families, in that they have to fight and sometimes sue the school districts. I understand what the school districts are saying. They got limited budgets and stuff, so they don't have it, but at the same end, unless you're going to pay literally a ransom to go to some of the special private schools, the public schools, everybody's going to move into the district here if you have the program. And they have to navigate so many hurdles. I really feel for these parents and obviously the kids, but it just feels like it shouldn't have to be this hard as it is, You
would think there'd be a blueprint on how to deal with kids that have special needs. My son has special needs, or kids that are dealing with autism. I know for a fact with the school districts, Richard, across the country, the parents, it's funny you chose to use the word fight. The parents oftentimes have to threaten to sue because the district doesn't want to take them out of the school district.
Sometimes the district says,
because it's 40,000. Right,
if you sue us, then we can do it.
Then we can do it. Because if they take them out of the school district, you're talking $40,000, $60,000 a year, and they don't want to pay those fees.
Well, it is World Autism Awareness Day tomorrow, and we encourage you at home, obviously, to be a part of our conversation. So please go to Facebook and Twitter and answer our question tonight. What are some of the hidden challenges that people living with autism face? And for those of you dealing with this on a personal level, if you would, please share with us those personal experiences. All right, when we come back, we'll switch gears to politics, and some GOP heavyweights already betting on Bush. That's right, on a Bush in 2016 here. We're going to talk if Jeb Bush could really be the guy for the GOP. Stay with us.